నారాయణ స్టూడెంట్స్ అందరూ యూట్యూబ్ స్ట్రీమింగ్ లో ఉన్నారా?
Yes, sir. We will start the session. I request Dr. V. Sudhakar Rao sir to start the session.
Sir.
Yeah, you please.
Secretary sir, shall I start?
Yeah, you please start.
Not lifting the phone.
Okay. Good evening all. As per the tradition of our institute, before the commencement of the program, let's have a video promo on Biology Institute of Technology and Science. Over to Narayan sir for display of the video.
Balaji Institute of Technology and Science, Wi-Fi enabled lush green campus spread over 80 acres, highly committed doctoral faculty with research laboratories, first and only best engineering college securing highest placements in Telangana, 100% placement assistance with 250 plus students placed in 2017-18. Tie-ups with 100 plus companies to achieve 100% placements. Conducting guest lectures with IIT and NIT professors. For placement details, visit www.bitswgl.ac.in. Spacious and well-stocked library with national and international journal. Conducive academic environment with traditional approach. R&D lab for new innovation in engineering. Separate boys and girls hostels within campus. Choose BITS for assured placements. Balaji Institute of Technology and Science, Lakanapalli, Narsampet Road, Warangal.
Thank you, sir. Good evening, everyone. On behalf of Balaji Fraternity and Balaji Group of Institutions, I, Dr. V. Sudhakar Rao, Associate Professor, Department of Humanities and Sciences, delightedly welcome Dr. A. Rajendra Prasad Gadde garu, the Chairman of Balaji Group of Institutions, Dr. G. Rajeshwar Reddy garu, Secretary, Balaji Group of Institutions, Dr. V. S. Hariharan garu, the Principal, Balaji Institute of Technology and Science, Dr. L. Sampath garu, Principal, Balaji Institute of Management Sciences, and our today's resource person, Dr. Bhanu Prasad Gadde garu, and Dr. V. Narayan garu, convener of today's faculty development program and the head of the Department of Humanities and Sciences, Srimati A. Karunasri garu, coordinator, and Mr. Rajam, co-coordinator, all the heads of the departments, faculty friends, and all the participants from various parts of India for today's inaugural ceremony of 9-day national level online faculty development program on foregrounding the spectrum of character building in modern human life. This faculty development program is planned to cover all the ingredients which are needed for building of our character in this modern life. So we have devised in such a way that every day one significant aspect is covered so that all the important domains will be covered during this 9-day program. Hope this program would be quite useful for all the participants. Now, I would like to request Mrs. A. Karunasri to give an introduction on Balaji Group of Institutions and Department of Humanities and Sciences. Over to Madam.
Thank you, sir. Good evening, everyone. At the outset, I would like to familiarize you all with our prestigious Balaji Group of Institutions. The Balaji Group has a plethora of reputable institutions spread across a large campus. We have Balaji Institute of Technology and Science, Institute of Pharmaceutical Sciences, Management Sciences, Institute of Nursing, Balaji College of Education, Balaji Degree Colleges, Balaji Junior College, Vocational College, and Balaji Integrated Techno Schools. That is, KG to PG courses are offered through our Balaji Group of Institutions. We have a magnificent infrastructure, cutting-edge labs, and a highly qualified faculty. We also have fantastic sports fields, gyms, hostels for boys and girls, and transportation are all available. Balaji Group of Institutions are spearheaded by Chairman Dr. A. Rajendra Prasad Reddy sir and Secretary G. Rajeshwari Reddy sir. The main purpose of establishing our group of institutions is to offer education to rural people in the surrounding areas of Narsampet, educating and thereby placing our students in a reputed companies is the motto of Balaji Group of Institutions. Now, I'd like to apprise you all laconically about Balaji Institute of Technology and Science. It is popularly known as BITS, located in Narsampet, Warangal. Our college was established in the year 2001. Our college is affiliated to JNTUH and accredited by NBA and NAC A+ grade. We offer campus recruitment to our students, training to our students. We conduct on-campus, off-campus, and pool campus drives. We facilitate the students to achieve campus placements through appropriate and befitting training programs. We strive towards the students' welfare, academic growth, their placement, and overall personality. In BTech program, we offer civil, EEE, mechanical, ECE, CSC, and previous year, that's last year, we have introduced 3 more new courses in the BTech program, like artificial intelligence and machine learning, IoT, and software engineering courses. We also offer post-graduation courses in MTech and MBA. Now, as Humanities and Sciences Department is organizing the program, in a nutshell, I would like to brief you on our department. The department has an experienced and passionate faculty having specializations in diversified areas of sciences and humanities. The department has well-equipped laboratories such as the chemistry lab, physics lab, ELCS lab, advanced English communication skills lab, engineering workshop, C language lab, and BW lab. Students are given training to help them succeed in campus recruitment drives and competitive exams. The department offers communication skills and soft skills classes to students to mold their personality. We organize social events, co-curricular and extracurricular activities through various clubs and cells to empower students for all intents and purposes of personality building or personality development. The department holds FDPs, workshops, and guest lectures under the supervision of our head of the department. And this is one of the FDPs organized today. Thank you. Thank you.
Thank you, madam. I now request the convener of today's faculty development program, Dr. V. Narayana, who is also head of the Department of Humanities and Sciences, to speak a few words on this occasion. Over to Narayan.
Respected Chairman, Dr. A. Rajendra Prasad Reddy Garu, Balaji Group of Institutions, and respected Principal, respected Secretary Sir, and all the HODs of Balaji Group of Institutions, and all the faculty, especially all the participants who have registered across the India. Good evening to one and all. So we have planned 9 days faculty development program on foregrounding the spectrum of character building in modern human life. As we all know that since 1.5 years, because of COVID, we are unable to go out and doing all the things, and people are in so much fear and afraid. So why don't we encourage the faculty as well as the people at the society? So based on that thought, we have planned this 9-day FDP, character building in modern human life. This is for all the faculty and all the administration staff and everybody. This is a 9 days program as a part of schedule. Today's speaker, Dr. Bhanu Prasad Gadde, is a pharmacist from New York. And these are all the 9 days speaker. I thank all the participants who have registered. So far, we received 2,119 registrations. Today's speaker is Dr. Bhanu Prasad Gadde. The topic is very important nowadays, role of vitamin D3 to fight against the COVID-19. As before to inviting today's resource person, I watched so many videos on YouTube. Sir is very busy. When we approach it, immediately Sir has accepted. Thank you very much, sir. On behalf of college management and the department, when we approached, immediately you have accepted our request. Thank you, sir, and hope this program would be a great benefit for all the participants who have registered across India. At the end of the session, there will be a questions and answers. If you have any questions, you can write in. You can write in the YouTube chat box. Our faculty coordinators are there. At the end, our coordinators, whatever the questions raised by you, at the end, it will be delivered by the resource person, Dr. Bhanu Prasad sir. I hope it will be a great benefit for all the teaching fraternity in India. Thank you. Over to Dr. V. Sudhakar.
Thank you, sir, for giving a brief description of our FDP with screen sharing by showing the images. I'm now greatly privileged to invite our Secretary of Biology Group of Institutions, Dr. G. Rajeshwar Reddy Garu, to deliver his speech on this occasion. Over to Dr. Rajeshwar Reddy, sir.
Hello. Hello.
Sir,
Yes, sir, it is
audible, sir. Audible.
Yeah. Good evening,
Yeah,
all.
audible.
Yeah, good evening, all.
Good evening, sir.
Good evening.
Is my voice audible? And
Yes, sir. Yes, sir. It is audible. Clear.
yeah. Okay. So I think it's a very good topic to discuss after this lockdown and in the present pandemic scenario, which is very much related nowadays. Previously also it was very much talked about, and because my field is rheumatology, I get to prescribe a lot of vitamin D, which for some patients really work like magic. And so especially in it's I think it's attributed to its benefits is linked to almost most of the diseases like spinal diseases, immunity boosting, COVID, joint care, and lot of other diseases. And against our previous belief that we live in tropical climate and we will be in excess of vitamin D. So in reality, the vitamin D levels of most of Indians, if we check, it will be below normal level. I think our speaker, who is a well-known speaker, would enlighten us more about the present topic. So I would invite him, and I thank him for being part of this program. Yeah, thank you.
Thank you, sir, for enlightening on vitamin D. That is the topic of today's program also. And fortunately, we have all doctors on our management panel to get the suggestions from time to time. Thank you very much, sir. I now request our beloved chairman, Dr. A. Rajendra Prasad Reddy Garu, to talk on the topic. Sir, over to you, sir. Chairman, sir.
Respected Dr. Bhanu Gadde Garu, and respected our secretary, Dr. Rajeshwar Reddy Garu, respected Dr. Sudhakar Rao and Narayan Garu, and my principal and faculty, my dear students, and all the visitors. Good evening, everybody. First of all, I have to say thanks to Bhanu Gadde Garu, who is very busy to accept this session. Really, you are a very good speaker. I have gone through your profile. It's very excellent and encouraging profile for anybody itself. If one who has went through your profile, they have to be inspired. Your background of the education and all, after going to US, you have changed entire your field. It's not that easy to change. In fact, it is an encouraging for anybody, any student also. Now, settling in pharmacy is also very great, and particularly coming to the topic is very essential to everybody. And most this vitamin D is much enlightened during this pandemic. Before that, many people don't know about the this particular vitamin D. So thank you for coming to our meeting, sir.
So thank you very much, sir, for the message. May I now request one of our faculty members, Mr. Shyam Kollate Garu, to give an introduction of our today's resource person, Dr. Bhanu Prasad Gadde. So over to Shyam Kollate Garu.
Thank you, sir. I feel honored to introduce Dr. Bhanu Prasad Gadde. Dr. Bhanu Prasad has been a famous name for the last 1.5 years, both in AP and Telangana, for his service during the pandemic. Okay, the service actually we're going to see in this today's topic. And Dr. Bhanu Prasad is from New York, USA. He's the president of Long Beach Chemists. Okay, I mean, and I'll talk about his pharmacies also. And he was actually born and raised in Nizamabad of Telangana. That means, he's a son of the soil, Telangana. So he was graduated from Giriraj Government College, that is in Nizamabad. And he received master's in physics from University of Hyderabad. And then he went to the USA in 1991 for further studies. And subsequently, he worked for multinational companies like Oracle, Texaco, and Alcatel as a consultant. And thereafter, he went to pharmacy school in 2004 and graduated with a Doctor of Pharmacy from Creighton University. And he owns and operates 3 pharmacies on Long Island. And he's very passionate about health and wellness. And he believes in body's ability to produce healing if the nutritional needs of the body are properly addressed. And and finally, his work with vitamin D is really doing wonders these days. And it has given a lot of results. Okay, we have seen excellent results. Okay, and also more and more studies are confirming that vitamin D's role in addressing the complications of current disease. So now that's what actually he's going to address now. I'm so privileged to talk about Dr. Bhanu Prasad. Thank you, sir. That's all about.
Okay, thank you. Thank you, sir. May I now request today's resource person, Dr. Bhanu Prasad Gadde Garu, to start his session on the topic, role of vitamin D3 to fight COVID-19. So over to Bhanu Prasad, sir.
Thank you, Dr. Sudhakar Garu, and thank you, respected Chairman Garu, Dr. Rajendra Prasad Reddy Garu, and Dr. Rajeshwar Reddy Garu, Thank you so much. And I'm so glad to be among you and also among people who understand the role of vitamin D in health. And I'm so privileged to be part of this because your chairman and Chairman Garu and Secretary Garu are medical doctors and who will understand very well what we are dealing with. And also this faculty development program, when I saw this, the character, the foregrounding of spectrum of character development, that is such a just a lofty goal, because in the modern times and modern life has been characterized by gaining more and more and more knowledge, and so much so that we put our children through so much rigor of committing them to school from their early childhood. And if we ignore character development, um, a person with knowledge without a character is completely useless to the society. And when I saw this title, I was very encouraged. And I have to appreciate Dr. V. Narayana Garu and all the panel for coming up with this very important topic and very important, the foregrounding of character development. What a beautiful way to express the need of our time. The need of our time is not knowledge. I think we all have. I think there is explosion of knowledge nowadays, but the need of our time is character. And we grew up with. I grew up with so many of these stories around character development, and that used to be pervasive in my childhood. But later on, when we are going after this success, I think that has been laid aside for some reason. I think I have to appreciate and congratulate all of you, and especially the Chairman Garu and the Secretary Garu and the principals and all the panel for coming up with such a apt and wonderful topic. And I can assure you, I already can see this next 9 days are going to be very productive for all of you as well as the audience. So with that introduction, I'd like to go directly to the presentation. Let me share my screen. So, importance of vitamin D in fighting against COVID. So what is COVID? This is a disease that has not been, none of us have heard about a year and a half ago, but it has completely shaken the foundations of nations and foundations of societies and families. And it has completely has redrawn the landscape of health in India and everywhere else. It is a disease characterized by very high infection rate, and it has a rapid progression. We already can see in the second wave. In the first wave, it has spread. In the first wave, we were thinking that India is not a candidate for this kind of infection, because India is a tropical country, and we are not prone to this kind of viral illnesses. Little did we know that then that we will be suffering like this. The first wave came, and it has completely destroyed our confidence in our tropical climate and in our ability to deal with this disease. And then, as we were getting ready we thought, okay, we have overcome this, and the number of cases have fell down to almost 10,000 new cases a day by February. And then the second wave hit, and second wave was much more intense than the first wave. So in this context, I think we need to understand what this disease is. And if we do not have proper understanding of what this disease is, there is any effort towards overcoming this would end up in failure. Okay? So the initial measures did work to some extent. like PPEs and lockdowns and physical barriers and masks and all those things on isolation. And all these things did work to some extent. But when the pandemic reaches to a community spread, all these physical barriers will not work. Okay, we need a real solution. Physical barriers were employed to curtail the spread of this disease, while the medical professional or the scientists are trying to find a real solution. Okay, and the problem is, a year and a half later, the real solution is not forthcoming. Now we are hearing of the Delta and Delta plus variants, which do not have any treatment in our current medical practice. So the challenge is, we cannot continually dwell on initial measures. That is already seen. That is already clear. Okay, we have to have a real solution. Okay, and the economic downturn that results from this pandemic and the lockdowns and the extreme fear, the economic impact is very real. So much so that our positive GDP has plummeted to a lot, and which is impacting normal lives and livelihoods. Okay, the job losses and economic depression can disrupt societies. Okay? That is the economic impact of it, and resulting loss of life due to economic depression itself may far exceed the loss of life due to the pandemic itself. Okay, first of all, we need to know that here if I told you, okay, the virus is not directly fatal. Okay, some of you may be surprised. It is not the virus that is killing people, but it is the improper immune response. Okay, we have a prominent rheumatologist in our midst, and so I think Dr. Rajeshwar Reddy Garu was alluding to this fact. Okay? The autoimmune disease, okay, is nothing but improper immune responses to environmental or the challenges, the physiological challenges. Okay, it is the improper immune response to unmitigated viral proliferation that is the problem in this disease. Okay, and people are infective while asymptomatic. Okay, that is another problem here. And hypoxia and hypoxemia, even with breathing ability fully intact, that is another problem here. And the cytokine storm. Cytokines are the substances that are generated by the immune system to fight against the pathogens. These cytokines, and if they are generated in an uncontrollable fashion, that is what destroys the lungs and the other organs. Okay, so that is, and the disseminated intravascular coagulation, okay, and also DIC as well as the stasis, which results in blood clots everywhere, this microcoagulation everywhere in the body. Okay, and reinfection and deterioration is possible even after testing negative. People have celebrated that they're negative and they went home and eventually they succumbed, they died. And these are post-COVID complications and long COVID complications. Okay, and properly functioning immune system is our only hope. If we have to have, if we are looking for a solution, that is our only hope. Okay, so immune system basics. Okay, I'd like to just, I don't want to belabor this point very technically, but I just want to tell you, in our immune system there are two branches. One is innate immunity and the adaptive immunity. Okay, and I'd like to cover a lot more, and I'd like to present a few case studies. I don't want to dwell on this for too long. Okay, you have immune cells, and immune cells, not only immune cells, but every cell in the body has a receptor called a vitamin D receptor. Okay, this vitamin D receptor controls every aspect of cells processes. Okay, we have a process in the cells called this cellular transcription mechanisms, which is responsible for making proteins our body needs. Okay, the blueprint for these proteins comes from the DNA that is in the nucleus. Okay, and these transcription mechanisms, this is such a finely orchestrated dance, if you will, Okay, that is controlled by vitamin D receptor. Okay, what is vitamin D receptor there for? Okay, and if there is vitamin D receptor which is controlling all these processes, okay, how does vitamin D receptor work? Okay, if you have vitamin D receptor, that means it has to have proper levels of vitamin D. Okay, if vitamin D plugs into that receptor, and that is when vitamin D receptor starts working the way it is supposed to. Okay, so in the innate immunity, if you have proper vitamin D levels, this vitamin D receptor will be able to make these innate immunity and all the cells work in the way they are supposed to. Okay, so the takeaway from the first column is innate immunity works well if person's vitamin D levels are proper. Okay, and in a vitamin D deficient person, this vitamin D receptor is empty, and that receptor cannot function its job properly. Okay, it can be hijacked, and the cellular transcription mechanisms will not work properly. So that is the takeaway. So if there is proper vitamin D levels, innate immunity works well. Okay, so let's come to the adaptive immunity. Okay, and I mentioned there is the cytokine storm in the introduction. So this one of the cytokines that is of interest here is interleukin 6. Okay, IL-6. IL-6 is implicated in COVID-19. So if IL-6 goes up, keeps on going up and up and up and up, okay, what happens is the saturation goes down and down. What is saturation? Saturation is the oxygen level in our blood. Okay, and the lungs are responsible. There is a beautiful mechanism in the lungs, whereas in the functional unit of the lungs, I want to take you back to the basic biology, that high school biology. To understand my presentation, you need to have only the basic biology in, remembrance. That's it. Okay, so there is alveoli. Alveoli are these ball-like structures at the end of the bronchial tree. There's alveoli, that is where the gas exchange happens. Okay, and when we take the breath in, this oxygen, oxygen in our environment is about 21%. So that is fraction of inspired oxygen, FiO2, of room air is about 21 to 22%. So when we breathe it in, okay, there is this concentration gradient that happens. When you have a deoxygenated blood that has, the partial pressure of carbon dioxide is a little higher. Okay, for all your chemistry students, the partial pressures, right? Okay, so the partial pressure of carbon dioxide is higher, and the partial pressure of oxygen is lower. Okay, and when you in that environment, when you introduce this the oxygen, FiO2 of 21%, what happens is oxygen flows in, okay, across the pressure gradient, and carbon dioxide flows out across the pressure gradient. So when you breathe in, the blood is oxygenated, and the carbon dioxide from the blood, it comes out. It is such a beautiful mechanism. So that is the saturation of oxygen. That is oxygen concentration. So oxygen concentration goes up, and carbon dioxide concentration goes down, and that blood is circulated all over the body and providing oxygen to all the tissues. So that is, that is how the lungs, the gas exchange works. Okay, so when the IL-6 goes up, it causes tremendous amount of inflammation in the body. Okay, and that inflammation results in severe body pains, body aches, and that is severe myalgia. And myalgia is a benign symptom compared to what is going on in the lungs. Okay, what is going on in the lungs is this alveoli, the membrane surface is being inflamed by the rising levels of IL-6. IL-6 is like pouring acid into the lungs. Okay, so that is what happens. So when you have this IL-6, so we need to understand, see, the IL-6 is responsible for acute lung injury. And where is this IL-6 coming from? This is where it is coming from. In the adaptive immunity, we have two branches in the adaptive immunity as well. You have Th1 branch and Th2 branch. And all these inflammatory cytokines, like IL-6, are coming from the Th1 branch. Okay, and if we do not have proper vitamin D levels, okay, and these immune reactions always proceed towards Th1 branch, increasing the possibility of increasing the production of these inflammatory cytokines. That is where this IL-6 is coming from. Okay, but if a person has enough vitamin D levels, those immune reactions are modulated in such a way that these immune reactions go, they shift from Th1 to Th2 branch. Th2 branch is responsible for the anti-inflammatory cytokines. Okay, so that is that is basic immunology for all of us. Okay, so now once this happens, once the patient survives all this process of the Th1, Th2, the interferon gamma signaling and all these things, that is when the B cell activation happens. That is when the antibodies are generated. Okay, so the takeaway from this is innate immunity works well when you have proper levels of vitamin D, and adaptive immunity works well if you have proper levels of vitamin D. This is the reason why 90+% of the people are not affected by COVID-19 at all. They get it and they develop antibodies. Even some of them don't even have any symptoms. Okay, the problem is with the 10% of the people whose immune system is in a state of dysregulation because of lack of vitamin D. Okay, so I'd like to just go through another system called Renin-Angiotensin system. Okay, the Renin-Angiotensin-aldosterone system is there to properly manage this the mineral balance in our body, and thereby controlling so many these vasoconstrictions and the vasodilation, the way our vasculature works, and the way our kidneys work, the way our lungs work, is this renin-angiotensin system is tied into all that. Okay, so in renin-angiotensin system, okay, is important because this virus, okay, when it has to gain access to the cell to get into the cell, because virus does not replicate on its own. Okay, bacteria does. Okay, virus does not have the mechanism to replicate on its own. It has to get into the cell. How does it get into the cell? Because cells have defense mechanisms. Okay, how does it get into the cell? It has to bind to something called ACE2 receptor, ACE2 receptor on the surface of the cell. Okay, so ACE2 receptors are present everywhere. Okay, they are present in the lungs, they're present in in the vasculature, they're present in the kidneys, they're present everywhere in our body. Okay, so that is how the virus binds to ACE2 receptor and gets into the cell, and it starts replicating. How does it replicate? Because all the virion is nothing but a bunch of proteins and fats, right? So it has to have these proteins. It has to be able to make these proteins. Okay, so what does it do? It accesses the cell's transcription mechanisms. You heard that before, right? Okay, which are controlled by the vitamin D receptor. Okay? And if there are no proper vitamin D levels, the virus can hijack this process, the cellular transcription mechanisms, and start replicating at a much more feverish pace. There is scientific literature available. Okay? In hepatitis B, hepatitis virus, okay? in an environment of low vitamin D, the hepatitis virus multiplies a lot faster and a lot quicker than otherwise. Okay, so as it binds to ACE2 receptors and it destroys this ACE2 enzyme completely. So why is that important? Okay, so we have angiotensin 1 and angiotensin 2, and this has to be properly converted to angiotensin 1.9 and angiotensin 1.7. Okay, what converts that? Okay, it is the ACE2 enzyme that is responsible for this conversion. If this viral binding and destroys this ACE2 expression, what happens is angiotensin 1 and angiotensin 2 will not be converted there. So what is the problem? So if it is not converted, angiotensin 1 and angiotensin 2, they activate, they bind to AT1 receptor, and that causes vasoconstriction and fibrosis and cell proliferation. Think of cancer. and inflammation, and it is thrombogenic. Think of blood clots. Okay, so now if you have proper expression of ACE2, okay, and AT2 receptor and MAST receptor, they come into play, and they are responsible for vasodilation. Think of lower blood pressure, and it is anti-proliferative. Think of anti-cancer and anti-apoptotic, and it preserves the cell, pro-apoptotic. So that means it kills the cells that are not required. Okay, and so natriuresis, the proper balance of sodium and electrolyte balance is maintained. Okay? And also it is anti-proliferative, anti-inflammatory, and anti-thrombotic. Think of lower blood clots and vascular protection. So why am I saying all this? Renin-angiotensin system, say by this viral activity, this viral binding and destruction of ACE2, what it does is it upregulates renin. Okay, upregulates means it overdrives renin, and that causes this renin-angiotensin system to go into overdrive. Okay, and you have the increased expression of renin, and you have destruction of ACE2. What happens? It is all that is listed on the left side happens, and all these are complications of COVID-19. Okay, so where does vitamin D come in here? And vitamin D is the only thing that can predictably and repeatably downregulate the expression of renin. Okay, so vitamin D is coming out to be the champion in this in addressing the complications of this disease already, isn't it? Okay, now multi-organ injury in COVID-19. What is happening with COVID-19 is this. Okay, what we are doing is all the current treatment modalities, okay, are completely ignoring this, ignoring everything that we have seen so far. Okay, and this okay, it is not just stopping with the lungs. Okay, while the lungs are being destroyed, quietly the kidneys are being destroyed, and the brain is being destroyed, and the liver is getting into action, and the heart is being inflamed. So much so this heart rate is not able to be controlled. It is just going through, the heart rate is going through the roof. Okay, so if it is and also the fibers are the muscles, and the vasculature is getting involved, and the muscle is getting involved, and so much so that the people are inflicted with severe myalgias, and you have the pancreas that is getting involved. Okay, and so much so that many of these COVID patients are coming down with acute pancreatitis. Okay, so this is where the problem is. When we are trying to treat the symptoms, like we are trying to treat the blood clots, we are trying to treat the deoxygenation or desaturation by giving oxygen, we are not addressing the root cause. And quietly, it is these processes that are going on in our body are destroying this several organs. And even though we were able to preserve to some extent the saturations by pumping oxygen at pressure, all the organs are being destroyed, and we are not able to save the patients. This is in a nutshell, what is happening in COVID related illness. Okay, now where is the evidence for vitamin D, right? Okay, now vitamin D levels in the blood are they're measured in nanograms per ml, and they're nanomoles per liter. Okay, so these units are different. Okay, the numbers are different. To go from nanograms per ml to nanomoles per liter, you have to multiply nanograms per ml with 2.5. Okay, so let's, for the purpose of this discussion, let's stick to nanograms per ml. Okay, so the deficiency is in the blood. If you have less than 20 nanograms per ml of vitamin D, that is deficiency. And it is scary that many in India have their vitamin D levels in single digits, and in some people it is not even detectable. Okay, that is the unfortunate reality. Okay, as Dr. Rajeshwar Reddy Garu mentioned, in spite of the tropical climate, it is a travesty that our population in India is almost 90% deficient in vitamin D. Okay, and also the reason for that is the traditional understanding of vitamin D and vitamin D supplementation and vitamin D correction is not adequate. Okay, so let's come back to this slide. Okay, the insufficiency is from 20 to 30 nanograms per ml. Okay, and the normal levels are greater than 30 nanograms per ml, and 30 to 100 is considered normal. Okay, and now let's look at the graph on the right side. Okay, and if a group of patients, okay, who are deficient in vitamin D, and if they are exposed to COVID, and if they were to contract COVID, the fatality rate is 99%. So 99 people out of 100, they died in the deficient group. Okay, in the insufficient group, okay, so the people who have 20 to 30 nanograms per ml of vitamin D, okay, the mortality in that mortality rate in that group is 88%. That is extremely high. Okay, what about normal people? Okay, people with normal vitamin D levels. The mortality rate in them is only 4.1%. 4.1%. So looking at this, these studies have been available for a long time. Okay, and these studies have been available. That is where I have seen these studies in 2002 and in 2010, okay, where SARS was inflicting people in 2002, and MERS was a problem in 2010. Okay, those viruses were coronaviruses as well. Okay, and during that time, people who have their vitamin D levels over 60 nanograms per ml were not affected at all with those illnesses. Okay, now, and let's look at the disease progression here. Okay, and you have stage 1, stage 2, and stage 3. Okay, in the early infection, when the virus is proliferating, virus is replicating at a feverish pace, that is when the first 4 or 5 days patients do not have any symptoms at all. Okay, and the symptoms that that probably they are dealing with are light fever or a headache or little body pains, and everything can be taken care of by a tablet of Dolo or an antibiotic or whatever. But the problem is, that is those things that are being used, they are not addressing the viral proliferation, the viral replication at all. They are just providing symptomatic relief. Okay, and one more thing I want to say here is modern medical treatment protocols and treatment modalities, they unfortunately, they concentrate heavily on symptomatic approach to treatment. Symptomatic approach to treatment may work okay in chronic disease, but COVID is not a chronic disease. Okay, it comes and goes and takes the person within 10 days. Okay, the person who is walking and eating and talking and interacting properly yesterday is gone today. That is the nature of COVID. The symptomatic approach will not work. Okay, so the symptomatic treatment in the early infection, it progresses, it takes the person to the stage 2, that is pulmonary phase, that is the lungs get involved. This is where the HRCT turns positive. Okay, why is this pulmonary phase? Is it because of the virus or is it because of the inflammation? It is because of the inflammation. It is not the infection. Okay, that is a key point that we must, all the clinicians must understand. Okay, so the pulmonary phase is, so the demarcation point from the phase 1 to phase 2 is the bilateral pneumonia. So in the pulmonary phase, the lungs get involved, and this is where the interleukins, the IL-6 start, the action goes up and the saturation start coming down. And then you have stage 3, this hyperinflammatory response. This is the immune system is fully active and it is producing cytokines that like there is no tomorrow. And that is when the lungs completely get destroyed and there is multi-organ failure. Okay, let's briefly look at this slide where you have the treatment the protocols that are being applied, what are we doing? Okay, so during viral replication, we are giving antibiotics. Antibiotics are completely useless against viral infections. We all know that. Okay? And we are giving the steroids, oral steroids, or even IV steroids. And there are some YouTube personalities that are advocating giving 500 milligrams of methylprednisolone, okay, at home 2 times a day. That is dangerous. That is dangerous because that leads a person down the path of almost no return, because these steroids, even though they address the inflammatory processes during the early part of the illness, what they do is they are setting a person up for this delayed cytokine storm and hyperinflammation later on. Okay, that's when the delayed cytokine storm happens. The steroids will do nothing. Okay, and by applying steroids early in the process, okay, what we are setting up is we are setting this patient up for complete total failure in the later stages. This is the reason why when a person is admitted in the hospital with a CT score of 10/25, which is about 40% involvement, and they progress to 25 out of 25, that is 100% involvement within 3 to 4 or 5 days because of this. Okay, so we are applying wrong treatments at wrong time in this. So during viral replication phase, these things, antibiotics won't work, oral steroids won't work, and antivirals the problem is, the Fabiflu is the only antiviral that is available at this point, and Fabiflu has proven to be not effective against this virus. It is a completely, totally failed drug. Okay, that is being used even to this day at much expense, and also Fabiflu causes severe gastritis and the gastric problems. Okay, and this is where we need to preserve the function of every organ of the patient. At this point, we are applying wrong pharmaceutical agents. That is, those pharmaceutical agents are weighing down the patient. Okay, now we have the cytokine storm. This immune system is activated. You have the pulmonary phase. Here, what are we doing? We are using more antibiotics, more IV steroids, and we are limiting fluids. That is one of the worst things that can happen in this disease. We cannot limit fluids. This is not a typical pneumonia. This is atypical pneumonia. Okay, this is, the secretions in the lungs of COVID patients are so thick. Okay, and they're thicker, almost equivalent to cystic fibrosis patients, where we need more fluids, not less. Okay, and now we have hyperinflammation phase, where what are we doing here? We have high dose antibiotics again, high dose IV steroids, and we are limiting fluids. This is where we are applying remdesivir and plasma therapies, and where these things, by this time, the viral activity is completely gone from the body. It is our immune system that is active, which is producing this inflammation, where remdesivir is completely, totally useless in this stage. Remdesivir may be useful in the initial stage of viral replication, but remdesivir is totally useless. The mechanism of action of remdesivir addresses viral replication. When the virus is not replicating, why give remdesivir? Okay, so same thing with plasma. By the hyperinflammation stage, the B cell activation has already happened, and patient has their own, mostly their antibodies. Some of them are even IgG positive here. And now, because of all this, the steroids, there is a quiet process that is going on in the body, that is neutrophil upregulation. You have neutrophilia, and that the cytokines that are coming from the neutrophils are not able to be controlled with steroids, and you have the delayed cytokine storm. Okay, so with the current treatment, we are laying foundation for patients' eventual failure, and that is the reason why ICMR and the Ministry of Health have taken most of these drugs that are being used in the initial protocols out of the treatment of COVID. Okay, so vitamin D. Okay, what is the evidence? Okay, so here there are lots of published studies. Okay, but I just want to say, they have used almost 250,000 units to 5 lakh units, and we have used much more than this in India, because the immune dysfunction, immune dysregulation in Indian context has been, is just rampant, is so high. Okay, and also there is evidence that vitamin D3 could reduce risk of influenza and COVID-19 infections and deaths. Okay, these are all peer-reviewed, published studies. And also there is one more study that came out of the NIMS and Nizam Institute of Medical Sciences in Hyderabad and Gandhi Hospital. One of my friends, Dr. Lakireddy Maheshwar Garu, he is responsible. He is the chief investigator of this study, impact of daily high-dose oral vitamin D therapy in the inflammatory markers in patients with COVID-19 disease. It has been published in May in Nature magazine. Okay, so now vitamin D is there is a lot going on with vitamin D. There is another concept I would like to introduce here called vitamin D resistance. Vitamin D resistance is a possible cause of autoimmune diseases. Okay, see, everything that I have explained so far, okay, points to the understanding that the COVID-19 is an autoimmune disorder of the worst kind. Okay, so it is the autoimmune disorder. Okay, there is no question about that. Okay, so and hypothesis confirmed by a therapeutic high-dose vitamin D protocol. So there are rheumatologists and there are immunologists who are using high-dose vitamin D with excellent success, as Dr. Rajeshwar Reddy Garu has pointed already. Okay, vitamin D. Okay, so I'd like to just briefly go through this. Okay, proper vitamin D levels can suppress viral replication. How? Because proper vitamin D levels can control the cellular transcription mechanisms very closely, so that the virus cannot hijack this process. Okay, and proper vitamin D levels can modulate the immune system, as I have already explained to you. Okay, and it can prevent common viral illnesses. Okay, most of the people who have been following me for the past year and a half, what they have reported is this. Okay, and they have corrected their vitamin D levels, and they have been maintaining their vitamin D levels at between 80 and 100 nanograms per ml for the past 1 year. Most of them report to me saying, we have not even suffered a common cold during this time, and their glycemic control improves, the whole the body pains improve. Okay, so it can prevent common viral illnesses, and it can modulate the renin angiotensin system and prevent the acute lung injury. Okay, and we have seen, as soon as the patient start desaturating, we gave the vitamin D, just 1 dose of vitamin D, their saturations return recover almost 10 to 15 points. Okay, that is happening because of these 2 points that I'm going to discuss. It improves the stability of the respiratory epithelium by improving the tight junction integrity. The epithelium is a single layer, the cellular membrane. Okay, and if you have they are bound, these epithelial cells are bound by the tight junctions. Okay, and vitamin D improves the tight junction integrity. Okay, and it improves the endothelial stability. What is endothelium? All our blood vessels, all our intestine. There is a single cell membrane that protects us from from various pathogens, and even the chemical injury. So and it improves the endothelial stability by doing the same, by improving the tight junction integrity. And it downregulates that is called transforming growth factor beta. This is another cytokine. Transforming growth factor is another cytokine which is implicated in autoimmune disorders. Okay, so vitamin D looks like it meets all the challenges that are posed by COVID-19. Okay, so monitoring. The device that you see here is called a pulse oximeter. Okay, the first number that you see, SpO2, okay, that is the saturation of oxygen. okay, oxygen saturation in your blood, okay, and you put this on your finger, okay, and it measures your oxygen saturation and it measures your pulse rate, okay. And from the beginning, what we have been telling patients is just measure the saturation. If your saturation is 95 or above, you're fine. If it goes to 90, then go to the hospital. No, that's not what, yeah, that is important, but okay, but the pulse rate is extremely important as well, okay. And that is the most important factor here. If the pulse rate starts going up and up and up and up, okay, from pulse rate needs to be about 70 in a normal individual at resting pulse rate, okay. And I'm talking about the resting pulse rate, okay. And if it, you know, if all these processes, immune reactions are going on in the lungs, and renin, angiotensin system, renin is being upregulated, that is when the pulse rate starts going up, okay. It goes from 70s to 80s to 90s, the resting pulse rate, okay. I'm not talking about, you know, you walking around and doing some activity and measuring your pulse. No, not that. Okay. At rest, sitting down or lying down, okay, that is resting pulse rate has to be about 70. And we have seen the pulse rates of 150 plus 160 in many people, okay. And the thing is, and if we restore this pulse to normalcy, okay, that can be done by down regulation of renin-angiotensin system and by application of proper vitamin D levels, or proper vitamin D doses, okay. And that, if we can bring down the pulse to normalcy, that preserves the saturation. Saturation will not go down, guaranteed, okay. That protects the lungs and it preserves the saturations. And this simple device gives the ability to a clinician in an ambulatory setting or a home setting to manage a patient effectively and prevent hospitalization. The tool is the simple tool. One tool is this, and one tool is vitamin D, which is not even a drug, which is a nutritional supplement. Okay, so I'd like to simply compare the current therapies versus vitamin D. Okay, in viral replication, antivirals, okay, could be effective. Remdesivir could be effective, but it is not used during the asymptomatic patient. If the patient is not symptomatic, who would be willing to buy a drug that costs 40,000 rupees per vial in the black market? That is not possible. So the antivirals are applied at the wrong time, but vitamin D3 is effective. Okay, the inflammation in the lungs is misinterpreted as infection. Okay, and we are applying wrong therapies here. That is, high dose steroids, they could lead to delayed cytokine storm, and we are using high dose antibiotics which don't have any documented evidence here, and it can contribute to multi-organ stress. Is vitamin D effective? Absolutely it is. Okay, when we have a coagulopathy, that is blood clots, we are using anticoagulants that is leading to hemorrhagic strokes and bleeding from various organs later on. Okay, and see, the thing is, the COVID is affecting the endothelium and epithelium and all the layers in between, and we are applying anticoagulants. What does that do? Okay, anticoagulants is that is a disaster. That is a perfect storm that is waiting to happen. The bleeding is eventually the hematuria, and bleeding in the brain is in critical patients is unavoidable. Okay, so is vitamin D3 effective? Absolutely it is. It can prevent blood clots, and we have seen the D-dimer levels go from almost 8,000. Okay, depending on the units that you're 8,000 picograms to almost less than 500 in one day. Okay, cytokine storm. There is no effective therapy available here. Steroids, and they can lead to upregulation of neutrophils, as I mentioned, and it can lead to delayed cytokine storm. And is vitamin D effective? Absolutely it is, because it predictably and repeatably shifts these immune reactions from Th1 pathway to Th2 pathway, thereby reducing the cytokines, inflammatory cytokines. Endothelial damage, there is no effective therapy, and vitamin D is effective. Epithelial damage, no effective therapy. That is the one which is killing the lungs. Vitamin D3 is effective. Renin-angiotensin system upregulation, there is no effective therapy, and vitamin D is effective. Okay, and management in the hospital, we need to understand that and recognize that oxygen is not the cure. If the patient is desaturating, going from 95, 90 plus saturation to 80 or 70 or 60, giving oxygen will restore him to 95, 96. When you have FiO2, the room air of 21%, and you bring that FiO2 up to 100%, obviously that is going to increase the oxygen saturation. That is not fixing the underlying cause. That is not fixing the inflammation that is going on in the lungs. That is not fixing the inflammatory processes that are destroying the body. Okay, what it is doing is it is buying us a little more time. Okay, FiO2 from 21, you bring it up to 100. Yeah, saturation goes from 70 to 98. Okay, is that the time that we can just rest, rest and say, oh yeah, 98, we see 98 and patient is cured? No, oxygen is not the cure. Oxygen is, what it is doing is it is blinding us to the process that is going on, which is eventually is going to put patient at risk. Because if we put him on oxygen and it comes to 98, and if we don't address the root cause, the oxygen level goes down again, saturation goes down even on oxygen. We must control the inflammation. This is not a disease that could be monitored only twice a day. Okay? And patient's family must be involved in monitoring the patient constantly. Even in the ICU setting, family members must be included in the care team. This is a team effort. Okay? Effective therapies must be employed early in the game. The only effective therapy that I have seen in the past year and a half is proper levels, proper doses of vitamin D. Okay? And we need to recognize that this is atypical pneumonia, which requires more fluids, not less. The solution is, let's go to the source of the problem. The current treatment model is the chronic symptomatic treatment, which is failing. Okay, COVID-19 is a very complex disease involving multiple systems, and symptomatic treatment results in failure. And source of the trouble is immune dysregulation. The only tool that we have, the strongest tool, the only effective tool that we have is vitamin D. You fix the immune dysregulation, that is the cure for COVID-19. The champion of immune regulation is vitamin D3. That is available, that is cheap, that is available at fingertips everywhere. The blessing in India is vitamin D3 is available everywhere. It is plentiful. Okay, what about toxicity? Okay, and this is the Mayo Clinic proceedings, which was published in 2015. Vitamin D is not as toxic as was once thought. Okay, and historical and up-to-date perspective. This is how they conclude. The vitamin D toxicity can result if a person takes almost 50 to 1 lakh units of vitamin D for months on end, not days, not weeks, daily, up to 1 lakh units daily for months to years. That is what they conclude. And also, most of the toxicity studies were done with vitamin D2, which is a vitamin D analog, which causes toxicity because it is not properly converted in the liver. And vitamin D3, the toxicity is extremely, extremely rare. Okay. And what about kidney? As soon as I mention vitamin D, they say, oh yeah, it can kill kidneys. No such thing. Let's look at this paper published in 2011. So vitamin D causes vitamin D receptor activation. Okay, let's see what it does. It, as I told you already, it downregulates the renin, angiotensin, aldosterone system. Okay, and it also downregulates TGF beta, the transforming growth factor beta, which is another cytokine which plays a prominent role in autoimmune disease. What does this do? This drives down the inflammation. Isn't that what the problem is with COVID-19? It is inflammation, uncontrolled inflammation, unmitigated inflammation. But this vitamin D receptor activation, by driving down the renin-angiotensin system and by driving down the transforming TGF beta, by driving down IL-6, it is reducing the inflammation. Okay, so what does that do? It drives down the mortality in chronic kidney patients, and it upregulates the protein and creatinine metabolism. So that is the reason why creatinine goes up, not because your kidney is getting destroyed. Okay, and upregulation of protein and creatinine metabolism is a good thing Okay, the temporary increase in creatinine is not a bad thing at all. Okay, and this brings down the renal interstitial inflammation, and it is renoprotective. So vitamin D is the creatinine increase because of vitamin D receptor activation is being misperceived as nephrotoxicity. That is a misperception. That is a misperception, because if there are lakhs of people who are taking vitamin D at higher doses than what is being recommended now, ever since I started giving presentations, and none of them, not even one. Yeah, there are some, the creatinine increase, but as the vitamin D levels come down to about 100 or so, their creatinine level comes down as well. Okay, vitamins and supplements in this disease. Vitamin D3, magnesium is important. Magnesium and vitamin D, they work synergistically with each other. Zinc, okay, you don't need to pump yourself with zinc. Zinc 30 milligrams per day is plenty. Okay, if you take a lot of zinc, you will have gray hair. So, so don't overdose on zinc, because zinc you will get from food also. Vitamin C. Okay, one cautionary note about vitamin C is do not chew. Tell all the patients not chew the vitamin D chewable supplements, because that is ascorbic acid that can completely destroy your tongue and your mouth and cause severe inflammation in the mouth. Vitamin K2 also, it is very important. Okay, not vitamin K1, vitamin K2 is important. It is vitamin D3 and vitamin K2. They work synergistically. Multivitamin and multimineral, they are important. Okay, I just want to present a couple of cases before ending the presentation. Okay, we had a 34-year-old male who was tested positive and presents to on 7th day and was using medication suggested by a friend. Most of these ivermectin, doxycycline, and all those things, and Fabiflu. Okay, and he had breathing problem and chest congestion. Okay, and the chest CT showed this in a CORAD 6 and severity score 12 out of 40. And this is when the normal person would be advised to go to the hospital and get admitted because there is infection in the lungs. It is not infection, it is inflammation. Okay, his saturation was 97 and his pulse rate was 92, resting pulse rate. So there is already this activity, IL-6 activity picking up. So the plan was this, okay, and vitamin D3, 60,000 international units every half an hour for 5 hours. Okay, so that is total of 10 capsules, and followed by 1 hour dosing, and followed by 3 hour dosing, and followed by 4 capsules per day for 5 to 7 days. Okay, and patient recovered and completely doing well. And his, in spite of this CORAD 6 and severity score of 12 out of 40, and his saturations never fell below 97. And case 2 is this patient, 73-year-old, tested positive. He was vaccinated, and he was not able to eat any food as he was having pain. And his presenting SpO2 was 93, and the pulse rate was 101. Okay, this was the plan. And we gave D3 60,000 IU, started with 1 hour dosing for 3 days and reduced to 4 capsules per day. And this is how he progressed: SpO2 95, pulse rate 95, and it ended with 96 and saturation, and the pulse rate of 89, and patient recovered and doing well. Okay, the feature of most of these patients who recovered with vitamin D3 is they don't have post-COVID complications at all. Okay, and same thing here. I'd like to very quickly go through this. And this patient, 68-year-old female, and body pains, fever, cough, intractable cough. That is, cough is another problem which does not respond to any intervention. And only thing that it responds to is the nebulization with normal saline, with 3 or 4 drops of hydrogen peroxide, and 3 or 4 drops of povidone iodine, 10% or 5%. Okay, so doing that normal saline with hydrogen peroxide and povidone works wonders to properly and bring down the inflammation in the lungs. And even if it is needed, do nebulization every half an hour if it is needed. Okay, that controls the cough. Okay, and and as the 15th, the SpO2 levels were falling down, and on 19th or 20th May, they received a remdesivir injection, and SpO2 levels dropped to 80 without oxygen, and and 21st May, 11 p.m. SpO2 was 93 with oxygen and 86 without oxygen. And that is when they came to us. Okay, the plan was this, and we implemented this plan. We gave Arachital 6 lakh units, 1 vial, and then vitamin D3 60,000 IU, 1 capsule every 15 minutes for next 5 hours, and followed by 2 capsules every 1 hour, followed by 1 capsule every 3 hours, and then 1 capsule every 4 hours. And the oxygen levels were stable. After that, they were stable, and the patient was given vitamin D3 2,000 units, at frequent intervals, about every hour, every half an hour, until discharge. Okay, SpO2 changed like this. On day 4, SpO2 was 90 without support, and on day 6, 93 without support, and day of discharge without support, 96, 97, and the pulse rate was normal, and patient recovered and got discharged. Okay, and let's go to this patient. So 46-year-old male, and not tested positive, but the symptoms detected. And the positive and negative, that is the wrong thing at this point. Patients who are testing negative, because immune system, by the time they have these symptoms, immune system has already eliminated the virus. So they may likely test negative, but the immune reactions are still continuing and immune system is still active. That is the problem in this disease, as I have already mentioned. Okay, symptoms were high fever and severe cough. Okay, SpO2 was 96, and pulse rate was almost, started at 90 and was reaching 120 at this point. And patient's oxygen level, see, as soon as the pulse rate goes up, okay, if we do not address that, saturation falls down. It is inevitable. Okay, and if we let this pulse rate stay about 120 or above for 5 to 6 hours, that is when the saturations will come down, and that is when the acute lung injury is happening. And patient's oxygen level fell down to 83, and Arachital 6L was given. His oxygen level shot up to 95, and he refused to take D3 after that, according to the plan. And later he became weak, and he refused D3 altogether, and his oxygen levels went down to 65 within 4 hours, and patient eventually died. Okay, the reason I'm saying this is during the active phase of this illness, where the cytokine storm is happening and the immune system is overactive, that is when we need to give continuous doses of vitamin. Okay, and continuous level of calcifidiol in the blood is extremely important for to preserve and to control and to modulate the immune system. Okay, and case 9, patient 32-year-old male, positive, waited till the shortness of breath developed, and chest tightness, severe cough, extreme dyspnea. Okay, then SpO2 was 65 and falling, and the pulse rate was 100, around 100. And patient admitted to the hospital. He was admitted to Warangal MGH, and came to us with saturations around 75 on oxygen support. Okay, his CT severity score was 18 out of 25. That was on April 28th, 2021. Okay, and this is a patient who was not given any hope at all, none whatsoever. And if 18 out of 25 is 80% lung involvement, and with saturations of 75 on oxygen, that is a case that would end up in fatality within days. Okay, so what we did was this. The plan was on April 29th, we started, we told the patient's family to start vitamin D, and so from April 29th, pardon my date convention here. So April 29th to May 8th, okay, about 10 days with aggressive doses, okay. And acetylcysteine 600 milligram effervescent tablets was given every 2 hours, waking hours, and nebulization with Budecort and normal saline and hydrogen peroxide and betadine iodine. And he was given for egg yolks. Egg yolks is very important. Egg yolks have phospholipids And you have we have lecithin, which is extremely important for the function of the alveoli. Okay, and alveoli function because there is surfactant. At the surfactant is important for the alveoli to properly expand and contract. Okay, and egg yolks preserve that surfactant production. Okay, and he was given 12 egg yolks per day very promptly, and breathing exercises every 10 to 15 minutes in every hour. Lemon water with rock salt, the salt that is the natural sea salt. Okay, and buttermilk with rock salt was given 4 times a day, because one of the features in COVID illness is the people's electrolytes are going out of control. Okay, sodium levels are dropping well below 130, like 110. I know we have even seen 103, 104. Okay, that is very dangerous. And the potassium levels dropping also. And water was given 5 liters per day in this patient. And this is how the patient progressed. The oxygen supply 15 liters, his saturation slowly improved from 65 to 88, okay, without support. And every day they went up point by point by point until the saturations reached 99% on June 1st. And patient was discharged on June 1st after complete recovery. Okay, and patient was cared for by his younger brother. Every moment he was there shadowing the patient. Every moment he used to call. Okay, if he observed anything, he called us. Okay, and patient is doing well, and creatinine normal, and it elevated a little bit afterwards, but the mild hypercalcemia, which is being managed. Okay, what about hypervitaminosis? This is what is being addressed. What, giving all these doses, okay, giving this extreme high doses of vitamin D, would it not cause problems? Yes, it would. Okay, it can. Okay, but let's look at all the problems that are possible with this. Okay, a few patients who required very high doses developed symptoms of hypervitaminosis. Yes. But these are the people who were not drinking enough water, and they were restricting fluids, and that resulted in hypercalcemia from 13 to 17 mg per dl of calcium in the serum, and elevated creatinine from 1.3 to 5.1 milligrams per dl in various patients. And electrolyte imbalances were present. That is a feature of COVID. And we started them on IV fluids, and we gave sodium bicarbonate and calcitone in nasal space, and some on zoledronic acid, 1 dose IV. And we did electrolyte correction, and the constipation was dealt with lactulose and Ducalax and saline enemas, and hypertension was dealt with, the ARBs and calcium channel blockers and nitrates. And patient saturation completely. All these patients, their saturation was preserved, lungs were protected. Okay, but these problems, okay, can be managed. The symptoms of hypervitaminosis can be managed. We have the medical expertise to deal with this, but we do not have the medical expertise if the lungs are completely gone. Okay, so. And let's look at the pharmacokinetics and dynamics of the vitamin D. Calcitriol, the activated form of vitamin D, the half-life is 15 hours. Okay, and calcifidiol, the first hydroxylation, after first hydroxylation, that is called calcifidiol, that half-life is about 15 days. Okay, so let's say we drive the patient's vitamin D levels up to quadruple digits, probably 1,000 or so. Okay? And yeah, that is toxic, but within 15 days, that comes down by half. In 15 more days, it comes down by half. In 15 more days, it comes down by half. So in 6 weeks, their levels are completely normal. Okay, and also if somebody is told, okay, you're toxic and you stop, and let's say their level is 100. Okay, within 15 days, it is their level goes down to 50, and within 15 more days, within a month, it goes down to 25. They are deficient again. So vitamin D correction is not a simple thing, and also continuous intake of vitamin D in this modern times is necessary. Okay, so, and I already mentioned that creatinine level going up is a protective mechanism, and it is not a destructive mechanism. And creatinine levels will come down to normal within 4 to 6 weeks. Okay, and thank you so much. And also my acknowledgements, as my sincere gratitude to the members of Corona Rescue Team who are doctors and medical professionals and everyone who have recovered from COVID-19. And there are people who recovered among your faculty by using vitamin D from COVID-19, and they are helping others recover. And they are working tirelessly with patients that are failing and bringing many from the brink of death. Okay, I just want to give you another case. This is the case on the left side. This is the X-ray of the lung. Okay, this is the patient whose saturations were 75 on a BiPAP machine. Okay, and we started vitamin D aggressive doses, and within 3 days, his lung improved to the right side. What you see on the right side there, and his saturations from there 75 on BiPAP machine, they came to almost 95 to 99 on BiPAP machine, and after 2 days after that, he was his saturations were above 90 without oxygen, and he was discharged from the hospital and in good health. Okay, so the management, the thing is, the summary is this: okay? COVID-19 is a complex disease. The solution is our immune system, properly modulating and properly regulating the immune system. And if we can fix the immune dysregulation, we have the cure for COVID. That is the summary. And thank you so much. And hope that was helpful. And I'll take questions.
Shyam sir.
Yeah, I request Mrs. Karnasri, you please proceed further.
Thank you. I thank Dr. Bhanu Prasad sir for enlightening us with session, and thank you, sir, for presenting us a detailed information on role of vitamin D3 to fight COVID-19, and covering the points on how vitamin D3 cuts the risk of COVID-19 and many more points. And I think this is quite useful for all of us, especially in these days. We are very much grateful to you, sir, for taking lots of pain. You have been presenting us the session from New York at this odd time even. Thank you. Thanks a lot, sir. Really, you have taken special interest and care for which we all are indebted to you. Thank you, sir. Sir, there are a few questions raised by our participants. May I?
Yes, please go ahead.
Rakesh Thakur and Parali Srinivas, their question is, what is the dosage that to be taken for a week, that vitamin D3 that should be taken per week?
Yes. Okay. So the thing is this. Okay, the vitamin D deficiency is a reality in our society. Okay, to fix vitamin D, unless you know your vitamin D levels and you have not been supplementing with vitamin D, assume that you are deficient. Okay, for those people who have not used any vitamin D, my suggestion is this. Okay, take one capsule of 60. This is for the adults. One capsule of 60,000 units. Okay, twice a day for 7 days, 2 times a day for 7 days, 160,000 in the morning, 160,000 in the evening for 7 days. And after that, go to once weekly dosing. Okay, so 7 days, twice a day, and then go to once weekly dosing and continue that for 8 more weeks and then get tested. Do not test yourself after 7 days. Okay, so then get tested after almost 10 weeks of taking vitamin D, then get tested. Okay, and the goal is to maintain between 80 and 100 nanograms per ml. Okay, and also if you are positive, you see, if you're tested positive, then the dosing is different, as I have mentioned in those cases. But for prophylaxis, to quickly correct your vitamin D levels can be very quickly corrected with proper dosing. So one capsule of 60,000 units twice a day for 7 days, and then go to some of my documents say for 5 days, and then go to once a day for 5 more days, and then go to weekly dosing. So either way is fine.
Thank you, sir. Like Priya and Parili Srinivas and Prano Gathai, They were asking like, is only vitamin D3 alone sufficient to fight against COVID? And why in corporate hospitals, why doctors are not suggesting vitamin D3 tablets?
Yeah, see, that is a very good question. Is vitamin D alone is sufficient? I think in my experience, I know in my experience, there are several doctors and several of our patients who are failing on at home and even in the hospitals. We were able to just give vitamin D, and they came back completely and totally. We had almost in the initial stages of COVID, we had 100% success rate with proper doses of vitamin D. So vitamin D is enough. If we properly identify the problem as a dysregulated immune system, and none of the drugs in the protocols do anything, okay? And yes, what we have used is, yes, paracetamol for fever. Yeah, if you have fever, yes, paracetamol is important. And if you have gastric distress, yeah, use those. That is fine. Okay, but to address the challenges of COVID, as I have presented in excruciating detail, okay, all the challenges that are posed by the COVID-19 infection are met by vitamin D at their root level. So yes, if you ask me, yes, vitamin D is sufficient, and if we do it properly, and if we bring up people's vitamin D levels to a proper level in time, okay, the symptoms in those people are extremely benign, and we need not give as much vitamin D as is required by some of these people who have progressed to this cytokine storm stage.
Thank you, sir. Dr. V. Sudhakar Rao's question is, 30 mg per ml of vitamin D3 is acceptable to our body. To what maximum extent we can use this vitamin D3, and will there be any problem to us if we have more vitamin D3?
Yes, that is a good question. Yes, the 30 to 100 nanograms per ml is a very broad range, but in this pandemic, I would narrow that range to 80 to 100 nanograms per ml. Okay, and that is what Dr. Lakireddy Maheshwar Garu also concluded in his study, and I have been in contact with him for the past year and a half or so, and he became a very good friend of mine. And he completely conquers that 80 to 100 nanograms per ml is the range that we need to maintain this vitamin D. And also, when I said every cell in our body is equipped with vitamin D receptor, and vitamin D receptor is the one which is responsible for regulating all the bodily functions, most of these cellular functions. That means, if you're not giving if you're not giving your body enough vitamin D, that means all the cells are not functioning at the optimal level. Okay, so yeah, the problem is the problem is not taking the single doses or high doses of vitamin D. That is not where the problem comes from. But if you keep on taking this 120,000 units or 2 capsules a day for 6 months to 1 year, that is when the problem is. When your vitamin D levels in your blood go up to 300, 400 nanograms per ml and stay there for a long period, that is when the problem comes. Okay, the problem is always, just get your calcium levels measured. And one of the telltale signs of vitamin D toxicity is not telltale. The obvious signs of vitamin D toxicity is your calcium level goes up. Okay, and when that goes up, let's see if your vitamin D is 300, 400, which is impossible to achieve with these doses that we are mentioning.
Thank you, sir. And like Santosh Patra's question is whether sunbath has supplementary to boost vitamin D3 supply. And one more question, like from Fanindra. Would you like to suggest like vegetables to enhance these vitamin D3 levels?
Okay, so this is a great question. So sunbaths, yes, absolutely, you can and you should. We all should do sunbaths. Okay, but in an Indian context, doing sunbaths is very difficult because we are a culture of sun avoidance. Okay, we want to preserve the complexion of our skin. Okay, and the thing is, so much so that we avoid sun actively. Okay? That is one thing. And the sun rays that are that are responsible for vitamin D production are present in the sun from 11 a.m. to 3 p.m. or 11 a.m. to 3 p.m. So how do we it is almost impossible to go into the sun during that time because the rays are intense. That is when the ultraviolet B radiation is present in the sun rays. Okay, that is one thing. The second aspect is your diet has to have we have to have proper diet for vitamin D production in our body. So vitamin D is produced from cholesterol. Okay, cholesterol. You heard it right. The starting the substance for the biosynthesis of vitamin D is cholesterol. Okay. Our cholesterol levels have to be proper, and also that cholesterol needs to be transported to the skin. Okay, there is so much biochemistry that happens. Okay, and our diet plays an important role. Okay, and in our diet there are so many chemicals, organophosphates and organophosphonates, the pesticides and herbicides. Okay, these are the ones which completely mess up this cholesterol transport mechanisms. Okay, and if the cholesterol is present, let's say, and because we are waging war against this cholesterol for the past 50-60 years, and so much so that we are avoiding ghee. Ghee is healthy, okay? But we are avoiding ghee because we are told that it is causing high cholesterol and and then we are avoiding eggs, the egg yolks. Egg yolks have this is that is wonderful source of proper nutrients. See, to go into the sun and get vitamin D, there are so many things that need to happen. Your diet has to be proper, our chemical exposure has to go down, and then we have to go into the sun from 11 to 3 in the morning, 3 in the afternoon. Yes, it is possible. Sunbathing is wonderful. So the vegetables you mentioned, the vitamin D does not come from vegetables. Yeah, even in the mushrooms, the vitamin D is present, but that is vitamin D2, not vitamin D3. So vitamin D3 comes from the animal sources, or you will not get enough sufficient quantities. But if everything, all the biochemistry in your body is working properly, then you go into the sun for 1 or 2 hours with 70% exposure of the skin, you will get about 15 to 40,000 units of vitamin D.
Thank you, sir. And Dr. Suman Chida, he was asking the questions like how to know the status of immunity against COVID-19 infection, which cells produce the antibodies that are specific to the coronavirus, and when an individual is infected with the virus, when will again the antibodies be produced?
Okay. So this is another excellent question. See, the thing is this, we have in the immunity, we have T cell immunity and the B cell immunity. Okay, and when the B cell activation happens, then you have the antibodies produced. The durability of these antibodies, okay, is based on so many factors. Okay, and in so many people, this durability is only 2 to 3 months, and so much so that people have been reinfected even after 3 months of getting infected for the first time. We have seen those. Okay, the T cell immunity is the long lasting, and in some people the T cell immunity does develop, and that confers protection against COVID infections for a much longer period. Okay, so we do not. There is so much about this that is completely unknown. I think studies are underway to establish that. But in all this, if you maintain your vitamin D levels properly, the T cell immunity works well, and your B cell immunity works well, and the antibodies are produced exactly targeted to the pathogen that is infecting us, instead of just the vaccines produce the antibodies to only the spike protein. Where there is a mutation in the spike protein, those antibodies are useless. And so there is, in the medicine, there is a concept called neutralizing antibodies and non-neutralizing antibodies. Okay, so if we are infected with the virus, and if we have proper vitamin D levels, and if the person comes through, that person has neutralizing antibodies. But in the most of the people who take the vaccine have non-neutralizing antibodies, which is a problem, which can cause this antibody dependent enhancement. And in those people, if antibody dependent enhancement happens, the further exposure to COVID virus is going to be much more fatal, much more dangerous than people who are not vaccinated. So this is an extremely important question that we need to ponder, we need to consider.
Thank you, sir. Many of these participants have posted a question. The participants like Biju Abraham, Arish Batullah, Sarbajit Kaur, and Javid Khan and Falguni Datta. These have posted. Like it is being said that third wave of this COVID-19 will affect children more than adults. So why it is predicted, and there is no it is said that there is no vaccine for children. So what is your talk on that?
See, the problem is the vaccines are not effective. Okay, and we already know by now from various the reputable sources that vaccines are useless against the Delta and Delta plus strains. Okay, and so we need to be very careful here. And also this talk about the third wave is going to affect children much more than adults does not have any basis in scientific reality at all. And this is more of a I think a sensationalism, and the reporting is not proper on this. And it has been confirmed that the sensationalism is confirmed by Dr. Guleria of AIIMS in Delhi. Okay, there is no basis that it would affect children more than adults. It is going to affect all of us. It is going to affect all of us. And what we need to focus on is immune dysregulation. Yes, immune dysfunction. There is immune dysfunction even in children. Okay, and that dysfunction can be quickly corrected with vitamin D. See, the problem is it is not like we have to have a Nobel Prize winning drug. That is already here. We already have it. Okay, let's maintain our vitamin D levels at where they need to be, and whether it is children, adults, or older people, or so geriatric people. Now, in everyone, vitamin D correction is important and is imperative. Okay, I just want to point you to one country. During first wave, this country is Mongolia. Okay, it was surrounded by countries where the COVID has been wreaking havoc. Okay, but during first wave until November of last year, there was not even one fatality in that country. Why? Because 2 years ago, one of my friends here, Dr. Leslie Ray Matthews, okay, he was called to that country. Dr. Leslie Ray Matthews is an expert, and he's a trauma surgeon who has been using high doses of vitamin D in his trauma practice. The success rate is extremely high. Okay, and fatality rate in severe trauma cases is 15% national average, and in his practice, it is less than 3%. Okay, and he was called to that country in Mongolia as a national. The national call was given for vitamin D correction. 2 years ago, they have corrected all their vitamin D levels, and that is the reason why there was not even single fatality in that country during first wave. Yes, the fatalities have started during the second wave. After November, there was 1 or 2 or 3, and now there is a total of 280 fatalities in that country. Okay, and the problem is that the vitamin D level, maintaining vitamin D levels at proper level, it takes effort to do that. Okay, it takes continuous input to do that. So, if as a national emergency, if we start correcting vitamin D levels in people, I think this pandemic will just vanish, go away.
Thank you, sir. The last question by Santosh Patra. He is suffering from osteopenia, it seems. So what type of treatment is required? So his question.
Absolutely. The osteopenia. So most of these problems have severe nutritional deficiencies at the core. Okay, so for osteopenia, so we need to look at the bone. Okay, what is the bone matrix consist of? Bone matrix consists of 70% of the bone matrix is collagen. Okay, and once we reach a certain age, about 30 years, the collagen levels go down unless we properly supplement collagen. Okay, it is which only comes from proper animal sources, and it's very difficult to maintain the bone matrix. That is the reason why in the modern times, people are osteopenic, and osteoporosis is rampant. Okay? Unless we build that bone matrix up, okay, there is no place for the mineralization to take place in the bone. Okay, so vitamin D is important. Vitamin K2 is important because vitamin D is it lets us absorb calcium, and vitamin K2 is important in calcium transportation mechanisms, where the calcium, it's like K2 is like a traffic cop telling calcium where to go. Okay, instead of going into the arteries, instead of going into the tissues, it will be properly directed to the bones where it belongs. So osteopenia is it is a difficult problem, but it has a there is hope. Okay, we can nutritionally address osteopenia and most of the bone disorders.
Thank you, sir. Answering all the questions in detail, and thank you very much for answering the questions patiently. Now, over to Narayana, sir.
I thank today's resource person, Dr. Bhanu Prasad sir, for your wonderful talk on role of vitamin D3 fight against COVID. Most of the participants, they have raised the questions, but due to the limited time, we restricted. Now I'm going to send the feedback link to all the participants. Just now I have posted feedback link in your chat box. Please verify. Okay. Every day we are going to post feedback link in the YouTube chat box only. I thank once again the today's resource person, Dr. Bhanu Prasad sir. In spite of his busy schedule, when we approached, immediately sir has accepted our request. Thank you very much, sir. Hope many of our participants, they have enjoyed, and whatever the questions raised by them, sir has cleared every question. As a part of the schedule, tomorrow's session is Dr. M.A. Karim Garu, State President, Telangana Psychological Association. He is a renowned psychiatrist. The topic named COVID-19 mental stagnation. Nowadays, the students are very much feared about the examinations, when the college is going to start, when will examinations are going to conduct. So due to that, we have approached psychiatrist sir. When we approached, even sir accepted. And one more thing I want to tell you, tomorrow there will be another session by Dr. Bhanu Prasad sir. That is right. So this is exclusively in Telugu. Now, those who are from the participant from the people. One second, please. That is. Once again, I'll share in the group. That is exclusively for Telugu people. I'll share in the group itself. I request Mr. Rajan sir to conclude the meeting with the vote of thanks. Over to Mr. Rajan, the coordinator of today's program.
Very good evening, all. I feel it's a great privilege and honor for me to propose vote of thanks. First of all, I would like to extend my thanks to our honorable chairman, Dr. Rajendra Prasad Reddy Garu, and Dr. Rajeshwar Reddy Garu, secretary of this institution, and Dr. V.S. Hariharan sir, principal of this institution, for permitting us to conduct this 9-day FDP. Thank you, sir. And now I also extend my sincere thanks to our head of the department and convener of this FDP, Dr. V. Narayan sir, for your enormous support and guidance for organizing this wonderful event, sir. Thank you, sir. And I also thank all the heads of the department and my dear colleagues for your wonderful support and guidance in conducting this FDP. Now, I extend my sincere thanks to Dr. Bhanu Prasad Gadde, sir. In spite of your busy schedule, you're sparing your valuable time with us in giving a wonderful lecture, sir. Thank you, sir. Really, it's a wonderful session and informative. We enjoyed your session, sir. Thank you, sir, once again. And I also thank all the participants. Really, I extend my thanks to all the participants for your active participation and enthusiasm. Really wonderful session. I thank all the participants in making this event grand success. Thank you all. And I hope you will continue the same spirit, enthusiasm in the next 8 days. I thank all. Thank you, sir.
Once again, thank you very much, sir, for your nice talk. And even chairman, sir, and the secretaries are also, as they are busy with the other works, they conveyed, sir. They felt very happy. Thank you, sir, for accepting our request. So, with this, we'll close today's session. Thank you, everybody. Good night.